with our Expansile. The exact title of the talk is Paclitaxel-Loaded Expansile Nanoparticles for the detection and treatment of Intraperitoneal Mesothelioma.
Great, wonderful. Thank you very much for the introduction. I think we're good. Thank you very much. It's great to be here today and share with you some of the recent results from my group. And again, we're really interested in mesothelioma. And the theme of the lecture really is about three things. It's about location, it's about dose, and duration. And if we can understand all of that, we can maybe develop systems that are going to be highly effective at treating diseases such as mesothelioma. And that really is the disease that's motivating us. As you all know, this is a horrible disease. It's a cancer that basically affects the linings of the thorax. So you can have in the pleural sac, the pericardium, or in the peritoneum. It's highly, it's just an awful disease. About 3,000 individuals in the U.S. die from it. The cause is primarily asbestos, but millions of people are exposed to it worldwide. So even though we do have it under control in the U.S. as far as exposure is concerned, in the developing world it's quite different. And it's basically universally fatal, about a 5-year survival rate of a few percent, 10 to 15, and very high recurrence rates. This disease is really a local disease. Death does not come out due to a metastatic condition. 4 words you never really want to hear: intraoperative, hyperthermic, intracapillary chemotherapy, and that's really standard. And so they come in, they'll do a cut that they can see, do the best job that they can, and then they'll treat with chemo. And the chemo could be a local dose, it could be an IV dose, it could even be chemo that's added to that. And again, a lot of problems with toxicity, and again, death really comes out due to this progression of local disease. Now, like many of us, we're interested in kind of article strategies for treating this disease, and we have lots of reasons why using would be basically efficient. There's a number of treatments that have gotten FDA approval that are looked at for a number of other indications, but not mesothelioma. Particular interest is in responsive systems, and so again, you can think about a variety of different types of stimuli, be pH or oxidation, and then we can think about the responses that would actually occur. And my interest is really in pH and in swelling, and see if we can use that to trigger drug release so that we can get intracellular drug concentrations. And the way we're going to do this, we're going to solid polymer particle, and it's going to go into the cell, presumably taken up by endocytosis. Then the environment will become slightly acidic, and then that will cause a change in the polymer structure that it then swells. And so we'll go from a very condensed polymeric state to a swollen hydrogel state. And the net result of that will be dumping of the drug upon that trigger. And again, this is a pH system, but we're going to try to get high local drug concentrations with it. The way we make these particles is straightforward. You do a mini emulsion technique. We have our organic phase and aqueous phase. We emulsify, then we cross-link, and now we have these particles that in the presence of a mild acidic conditions might swell. The actual chemistry that we're using is shown here. It's an acrylate-based monomer. It has this triethoxybenzylidine acetal group here. We can make a small nanoparticle, about 100 nanometers or so. This functionality will be cleaved at pH 5, and when that happens, we expose these 2 hydroxyl groups, and now we go from a hydrophobic state to a hydrophilic state. Water should rush in, and we should see an expansion or a change in the overall shape and the mechanics of this material. We made a similar control non-expansile nanoparticle shown here with this benzylidine acetal. Again, very similar chemistry, except that it doesn't come off at pH 5, and so we have 2 groups that we can look at. Again, we use a mini emulsion polymerization procedure, and we can make small little nanoparticles, and again, we can change their diameter based on the surfactant that we used. One of the first experiments we did is we looked at the dynamic light scattering data as a function of time and pH. And in solid blue here, we see our expansile nanoparticles. And basically, we don't see any change in the DLS data as a function of time at pH 7.4. However, at pH 5, the dotted blue line, we see a change in diameter, suggestive that, in fact, we have a change in the structure. We can monitor the loss of the protecting group, and for our benzylidine, trimethoxybenzylidine acetyl protecting group, we can see that come off at pH 5, and it really doesn't come off at pH 7.4. The control, the non-expansile nanoparticles, basically we see no change at pH 5 or 7.4. We were quite fortunate just recently here to do some TEM. So at pH 7 we see these nice solid spheres. At pH 5 we see these structures where we have a solid core and this kind of hollow structure on the outside of a swollen network. And again, if we go to pH 5 for a little bit longer, you can again see much of that structure dissolved away. So again, giving this kind of hydrogel look. We were able to do freeze fracture TM as well, and again at 7.4 kind of small nanoparticles. But at pH 5 we see much larger structures, and to me it kind of looks like a balloon that's been basically covered and then taken the image of that. So both of those techniques, TEM, SEM, and dynamic light scattering are all really great, but it's nice to have another technique, and what we're using here is called a Q-nano. It's nothing more than really a Coulter counter, but at the nano scale. And so we have an opening here. As the particles go through, you have a change in the current, and you can relate that current change back to a volume. And it's a very nice way of characterizing the materials, as well as getting quantitative information on concentrations. So here at pH 7, we have about 100 nanometer particles. If we let them set at pH 5 for about a day, again, our distribution changes, and we have much larger particles. We can use this technique to actually follow this as a function of time, and so you can see the kinetics of swelling going from day 0 out to day 5, and again you're getting this change in distribution in particle size. Again, it should be highly dependent on the cross-linker because we go from a solid polymer structure to a hydrogel structure. So the materials I've been discussing have 1 weight % of cross-linker in them, so again we see a change from about 100 to about 600. If I use 30% cross-linker, I still get my deprotection to occur, but they don't swell. So again, it's really like creating a small hydrogel particle. One of the nice things about this technique is you can monitor the translocation rates that occur as the particle goes through the small opening. And so again, it goes through, get this nice sharp peak. If you use a little bit larger pore, you can take one of the swollen structures and watch it go through the nanopore, and again, get a nice sharp peak. But what's nice is if you make this hole just a little bit smaller, you can see this particle now come through, and it should kind of squeeze through, and we should get a change in the translocation rates. And sure enough, we do. We go from something very sharp when the hole is big enough and we have a large particle, to something where we see very long translocation time, suggesting these things are very deformable, they're very weak mechanically, and they can squeeze through very, very small openings. And again, if we look at those translocation times, if we have a hole, a nanopore that's large enough so that these small nanoparticles can go through, or a much larger structure and these expanded nanoparticles can go through, or we can actually squeeze them and get them through. So with this information in hand, we start thinking about a particular drug to deliver. We got interested in Paclitaxel. It's used in a number of cancers, a first-line drug, and it's actually used in intraperitoneal mesothelioma. Has an IC50 rate around 10 nanograms or so per mil, and yet there's a lot of issues with delivering it from a solubility standpoint. So the first experiment was to entrap the paclitaxel into our nanoparticles and then look at the release rates as a function of pH and time. So solid blue is at 7.4, so our expansile nanoparticles do not release the drug. However, if we go to pH 5, we see the dotted curve. Again, the drug is coming off. So we get that triggered effect that we're looking for. Our controlled non-expansile nanoparticles, shown in red, are actually a very poor control for drug release. In fact, there's no dependence on pH 7.4 or 5 for the release. And likewise, if we use PLGA particles, again, we see fast release from those. And so we don't get the triggering effect that we want to see. If you take these nanoparticles that are loaded with paclitaxel, treat them with cells, you can do simple cytotoxicity curves. Light blue is the empty nanoparticle, so it's not cytotoxic. Green here is paclitaxel, and light blue is our paclitaxel expansile nanoparticle. And we've done this assay many times. So, of course, with drug encapsulated, they're active just like in packs, but our curve is shifted to the right with our encapsulated formulation, meaning the IC50 is higher than what pure packs is. So that would suggest you actually have to give more drug to get a beneficial outcome. And in fact, we know the system works quite well. So part of the problem is how do we explain this result with the in vivo data I'm going to share with you in a minute. And what we think is going on is when you have this solid particle, it goes into the cell, it expands, it creates a hydrogel structure. Well, that hydrogel structure might have an affinity for the drug. And so can we simply have partitioning of the drug from the surrounding medium into that swollen structure? So here we did a simple experiment. We took our swollen nanoparticles into a dialysis cassette, into a beaker of water, added drug, wait 24 hours, and our swollen nanoparticle phase has about four times more drug in it. So there's that partitioning that occurs from the surrounding medium. This can actually be done in cells, so we can do the same type of experiment. So essentially we plate cells, and then we're going to add empty nanoparticles, and now we're going to add fluorescently labeled paclitaxel, so Oregon green labeled, and then we're going to quantitate how much drug is present. So here, if we just do cells and paclitaxel Oregon green, we get some amount into the cells. If I use PLGA particles plus cells and then add paclitaxel Oregon green, about the same amount. If I use the Expansile nanoparticles and then paclitaxel Oregon green, I get another boost. So it suggests that you can sequester that drug into the cell via this hydrogel trap. And in fact, if you label the nanoparticle with one color and the drug with another, you can see that they co-localize that's there. Well, this system has been active and is efficacious in a variety of different types of models, lung and breast cancer, for example. We got really excited with the following experiment. So, interested in intraperitoneal tumors. So here, a mouse has gotten an IP injection. We've waited about 7 or 14 days, and then we've given an IP injection of tumor that, of nanoparticles that's been fluorophore labeled, and sure enough, we see the fluorophore labeled nanoparticles, and it correlates very nicely with the tumor. And we don't see a lot of accumulation in the spleen, the liver, and the kidneys. And so this was really quite exciting, and it made us think about mesothelioma with the idea, could we actually get localization of our PAX-ENP to the tumor? Could we get a good release, a high release of drug there locally? Then, if we do concentrate it, can we prevent tumor establishment or treat established disease? And we're going to use two models. One's a prevention of establishment, and then one's an established disease. And of course, if we can do this, maybe we can make a change in current clinical care. So, as you might guess from the earlier studies, if we use fluorescently labeled EMPs, rhodamine labeled EMPs, they go into human mesothelioma cells, so that's all good. In fact, if we look at the rate at which they go in the malignant cell line, the rate is fairly fast, and so we see very quick accumulation. If we take a healthy mesothelioma cell line, it's much slower. So there's a difference there in the uptake with these nanoparticles into the cell. We talked a little bit about how these materials localize, and so now we've done another experiment where we've injected multiple animals with tumor cells, waited 2 weeks, and then done an injection, and then looked at different time points to see if, quote, the nanoparticles are located with the tumor. And sure enough, we see this, and it's not a transient effect. So even at 14 days, we still have our nanoparticle localized at the tumor. And if we use fluorescently labeled cells, ambient light, and of course, our fluorophore labeled nanoparticles, we can see everything co-localizes. So simple IP injection results in localization of the material there. So our first model was a prevention of mesothelioma. This is a much easier model. We simply inject tumor cells IP, and then we followed with another injection of one of our treatments, and we look to see for the established disease. And we'll just focus on panel C down here on the mid region of the slide. Tumor mass is on the y-axis, and then our treatment groups or control groups are on our x-axis. Obviously, if we give tumor cells, we get tumor. If we give tumor cells followed by unloaded nanoparticles, we get tumor. If we use PAC-CE as a control group, again, we still get tumor. If we use paclitaxel in our non-expansile nanoparticles, we see some reduction, but a pretty broad spread in our results. And if I use paclitaxel expansile nanoparticles, I see a much better outcome, a much smaller amount of tumor mass. And I think what it tells us is both about getting the drug to the site as well as keeping it in your carrier until you get to that site. And when you have systems that are leaky, such as the non-expansile nanoparticles, you get less than desired results. So let's go to a more difficult model. We're going to do, again, an IP injection of our tumor cells. We're going to wait 7 days to establish the tumor. Now we're going to do our treatments, and we're going to follow. And we're going to look at both tumor weights as well as a luciferase line. And again, in the saline-treated, lots of mesothelioma tumors. Unloaded is about the same. PAX-CE, again, a little better. PAX and non-expansile nanoparticles, a little better. And then we don't really see any disease in our PAX-EMP treatment group. If we look at the survival, again, survival's on our y-axis, days post-xenograph. In this experiment, we see a shift in the blue curve here, which is our PAX-EMP group. So all our other groups, be it PAX by itself, PAX Chromophore, unloaded, or PAX PLGA systems, those all don't perform very well. Now, we hypothesize that this effect comes about to a tissue concentration of drug. And so again, we can look at total paclitaxel concentration in the tumor. Again, similar study, we inject tumor cells, wait 7 days, do our treatments, and then 3 days later look for paclitaxel concentration. And the point is, with the PAX-EMPs, we see a lot more of drug at the tumor site than we do with the PLGA system or just the chromophore ethanol, the standard PAX system. So again, suggesting a difference there. Now, in the last study, we did 4 doses of 10 mg per kilogram per week. So let's up the dose and do that experiment. So again, inject tumor cells, do our treatments after 7 days, then look for establishment. And again here, what we see is, in fact, it's not that much better. So increasing the dose, the concentration, doesn't have that good an effect. What if we actually increase the number of doses but keep it at the 10 mg kilogram per week there? There it's much nicer. So what we're seeing is that after 80 days is where we are today. 80% of the animals are essentially still alive, unlike what we see in the unloaded PAX-CE group. So again, we're getting an extension of that. So now the question comes about, why are we seeing these effects and what's going on mechanistically? And so we know a couple things. The first is that we know that the nanoparticles are taken up by the malignant mesothelioma cells more than the healthy. So that's one data point. The second data point is that these nanoparticles don't upregulate or stimulate macrophages. So we've done that experiment. And we talked about how they can go into mesothelioma cells and get stuck there. All right. In fact, we can see that in vivo over a long time period, but you can also see it on simple histology. So the picture shown on your left here is after treatment, and all these little features in here are little hydrogels that are inside the cell. So one thought is maybe after this particle goes in, it swells, forms a hydrogel, it gets trapped there. That allows you to basically concentrate drug, but that hydrogel stays there. It doesn't get taken away. And so the question is, do these nanoparticles change or alter mechanisms by which waste products are taken out of cells? And so basically looking at autophagy. And so there's an experiment where you can do, and it's a little tricky to see here. This is our first one. So we can look for a marker, which is called LC3. And when that builds up, you know that the autophagic process is basically delayed. All right. And so the trick is, if we treat with our expansile nanoparticles, or if we treat with just media, we see this LC3 marker come up. And that suggests that, in fact, we're getting an accumulation of products, which suggests that we're not getting those expansile nanoparticles that are in the lysosome to be actually exited from the cell. And so they're still there active for us. Well, that opens up a really interesting question if we have a hydrogel within a cell, and that is, can we do something very different? So this is what we do today. We take a nanoparticle, we put drug in it, we try to deliver it to the site, and we get release of the drug there. Can we do something different? In other words, can we actually inject empty nanoparticles, get those to the tumor site, and now separately inject drug, IV or IP, and get that to accumulate in the tumor? And will we get a higher drug concentration there? Well, we know from a cell standpoint that we can do this kind of depot or reservoir effect. The top slide here is just cells with paclitaxel green, and we get some degree of drug in the cell. If we use the expansile nanoparticles, we get a much higher concentration of drug in the cell. That's the same thing that we saw earlier. But does that actually translate into an in vivo scenario? So we're going to look at 2 experiments. In the first one, we're going to inject tumor cells. We're going to wait 11 days. And then we're going to inject nanoparticles or saline. We're going to wait a couple days and then inject paclitaxel green and then see how much drug is in the tumor. All right. And as you see on the top panel here, we can see our nanoparticles light up and the paclitaxel green lights up, and those co-localize, so suggesting that the two are together. Our saline pretreatment instead of nanoparticle basically results in very little paclitaxel organ green being accumulated. The trick, though, of course, this is just all microscopy, and what we really like to do is quantitate this. And so we've done that. Repeated the experiment, used paclitaxel, done HPLC, and again, we can see that when we use the Expansile nanoparticles as a pretreatment followed by PACs, we get a much higher concentration there. So that really suggests that we can think about using these particles not only to concentrate drug via delivering the drug itself, but if we gave a second bolus of drug, could we actually get the concentration to go up a little bit higher and keep it there longer? And would that be a better outcome for the system? And so with that, I kind of want to wrap it up. We know a couple things. First, we know that EMPs possess a unique mechanism of intracellular expansion. We have a demonstrated pH release system here. Our EMPs localize to tumors in vivo, and we don't see much accumulation in the spleen, kidneys, or so forth. We do get concentration of drug at the tumor, and we think that's the reason we get a beneficial outcome. All right, it's because we get more drug at the site, and it's there for a longer time period. We see efficacy in both the prevention of and established mesothelioma models. I didn't have time to discuss today, but we know these particles do traffic through the lymphatic system, so that's great. And they're active in other systems such as lung, breast, or ovarian cancer models. From a clinical standpoint, there's a couple things we need to think about. I think if we can do any type of localized delivery using our nanoparticles or someone else's, I think that's a very effective way to do drug delivery and to reduce morbidity. And if we can do that, maybe we can make a change in the clinic. We can take advantage of lymphatic pathways to do our targeting, and maybe that will help us out. We're going to avoid or limit the morbidity that's associated with standard radiation or chemo. And current treatment is really limited by low drug levels. There's been some recent studies that have come out, both in the US as well as in China, where basically IV injections are getting about 1% or less of drug to the desired tissue. And so I really think this is all about location, dose, and duration. And if we can do that, we can make a difference. And mesothelioma is a particularly bad disease where poor survival and high morbidity are present. So again, it's about all local administration there. I didn't do any of this work. I had a really great group of students and postdocs. In particular, Aaron Grissett was the first gentleman who made the particles. Kimberly and Aaron then followed, doing some very nice work there. All of the animal work is done with a thoracic surgeon. She works both in the lung area and in the mesothelioma area, treats patients. And in particular, her fellows, Rong Lu, Onkar, and Morgan Schultz, our pathologist and imaging team, and funding. Of course, the kind invitation to speak today, and all of you for your attention. And with that, I'd be happy to answer any and all questions. Thank you.
Let's open for questions.
Joe.
Mark, maybe I missed it. What was the affinity? What was driving the affinity of paclitaxel?
Yeah. So in the second part where we actually have the expanded state and do that, I think it's my current understanding is I think it's just a partitioning coefficient, the same way you would have an octanol water partitioning coefficient. I think the hydrogel structure's got enough hydrophobicity in it that gives you enough of a boost that you can pull it out of the medium. And so even if that medium has serum in it, which you could argue that should be making it much more soluble in that phase, I think we're actually getting it to partition. And that's really kind of unusual, because I wouldn't have necessarily thought that when we started the experiment. You would have thought everything would have just gone out, but we wouldn't have set up some equilibrium process there.
Certainly people have done this with oligonucleotide complementary sequencing and post-administration have an antibody bond.
Yes.
But I've not seen it in a not selective but fairly selective approach.
Right. So there's certainly lots of evidence where people have been able to use different kind of binding targets. What's unique here is just using the gross polymer structure itself to change the local environment. And so we know that environment where the expanded hydrogel is more hydrophobic than water. You can do spectroscopic probes to show that. And so again, I think we're just kind of shifting it. And so if we can keep it there a little bit longer, I'd like to think that might give us a little bit better outcome. Yeah, no. That's a great question. So I don't have a lot of data. In the structure, the cross-linker is held together through master linkages, so it is going to degrade at a certain time point. When we look at 14 days and we've looked at 28 days, we still see evidence of it, but I don't have a good appreciation for if it's 3 months, 6 months, or 9 months. So we got to do that study. And then the same thing, on the same line, it came with your other questions today on biodistribution, right? All we've done so far is on the microscopy side. Obviously, the radio label will be key. But when we do what's interesting is when we do the histology on the liver, spleen, and kidneys, we don't see anything abnormal, and we don't see the polymer. And so my best guess, after this thing is expanded, basically it's just a large polymer network that's starting to degrade. All of a sudden it has a different size. The hydrodynamic radius is totally different. And now I'm thinking it's much more like a polymer as opposed to that hydrogel structure. And maybe that's where we're getting some of the difference there. We'll see. Yep. So it works. We see the same types of behavior if we look at ovarian, sarcoma, and mesothelioma that are IP. And so that's where we've been focused. Just because if we can get a large concentration of our dose there, we think that'll be a positive outcome. Excellent.
There's no more questions. We'll take a break here.
It's coffee time.